Welcome to another episode of Same Text, Different Font.
Hello.
An update on our social media. We are on Spotify, Instagram, TikTok, and on YouTube. For the YouTube fans, make sure to like, share, and subscribe to our channel.
Thank you for the reminder. Today, I wanted to discuss something a little bit more serious because it's something that I feel very passionately about. It's only because we care about our friends and family and listeners. We today would like to talk about health maintenance and making sure that you do the things to keep yourself healthy so that you can hopefully live a very long, healthy, prosperous life. Ready?
Yes.
Did you go to your annual physical this year?
Yes.
Good for you. Most people know the importance of having a physical exam done every year, but many people don't go. I think something in the way, I've heard different statistics, but something like anywhere from 20% to 60% of Americans don't go for an annual physical every year. I'm definitely guilty of it. There was a stretch of time I didn't go, and
they say healthcare professionals make horrible patients, which is true.
I think that is definitely true. I have been very privileged to not spend any time in a hospital as a patient. So I don't have that firsthand experience, but I can certainly speak for my family members, and they're also horrible patients. So sorry. It's the truth. Anyway, you should definitely go to, first you need to establish a relationship with your primary care physician. Now, don't get me wrong. I know it's very hard to find one that you like. It's also very hard to find one that you can schedule an appointment for.
And within your insurance, that's always something that's important as well. Look for somebody that is in network with your insurance, and you can most likely find that on the insurance website or on, if you have a doctor in particular, you can look them up online or just call their office to find someone that is within your network. The second thing is getting an appointment, which for me, getting an appointment is a little bit tough for people that work standard 9-to-5 jobs. It's often a little hard to get these appointments, but it's even harder to keep them because for me, I run late, I'm stuck at work, I don't get to make it to my appointment, or sometimes I have to take time off of work to get to the appointment, which sometimes is just not possible. So making time to care for yourself is very important because it starts with you, and then you can care for the other people around you.
What's that saying that they have on the airplane?
You have to put your mask on first before putting on someone else's mask. I know they don't say it like that, but that's
yeah, I was gonna say that
means.
is very long. I don't think they say it like that, but you know what she's trying to say is you have to take care of yourself so you can be there for others. And one way of taking care of yourself, other than making an annual physical appointment, is to also I think more importantly, is to take care of your mental health. That is something so important. I know we've gotten better as a society about talking about mental health and talking about anxiety, depression, PTSD,
grief,
chronic stress,
abusive relationship, which is abusive such as physical, emotional, mental abuse,
psychological. There's many different types of abuse. So there are so many different avenues to get help. And if you feel like you're in need of help, some of the things that I have used in the past, I've used Talkspace and I've used Headway to get a therapist.
Are these apps or websites?
They are websites that possibly have an app to go along with it. One of the apps that I definitely use almost on a daily basis is Calm. Calm is really nice because they have different things featured on their app. They have videos, they have podcasts, they have meditations, they have sleep stories for adults, which I don't know if you've ever tried it, but I certainly recommend it. I did not know I like to be read to sleep. It is a lovely experience.
I've thought about that because you told me about it, and
Right.
I thought about it, and part of me is like, well, I want to know what happens at the end of the story.
Oh, yeah. There's this one story I listened to as a sleep story, and I have not made it past the point of these 4 kids getting on the train. I don't know if they get to where they're going. I don't know if the train ride goes smoothly. Nothing. Because every time I find out that these 4 kids get on the train, I'm like
That's
zonked.
it. That's your point. It's
That's
like, okay, they made it on the train. Okay, I can go to sleep.
I can go to sleep now. I'm out like a light. But mental health is super important. People often feel that they shouldn't talk about it. There's a stigma for talking about it, whether that be something that you think is within your family, within your friend group, at work, whatever the case may be. I know when I definitely struggle with, sorry, I hit the mic. Didn't mean to do that. But I hope you can hear me still. One thing that I struggle with is anxiety, and that it was not something that I was aware of until a couple of years ago. And when I told Kristen, thankfully, she was super supportive. She encouraged me to establish care with a therapist, which I did. And I think therapy is something that everyone should try.
Yeah, I think, and there's different types of therapy. There's the traditional therapy where you're speaking with someone, but that's, I think, I've also done therapy in the past, and a big part of it is finding someone that you can connect with and feel comfortable to open up to. Someone that's relatable to you. And some people, they start therapy and they say, I don't like it, but it's really because they didn't like the therapist and they didn't have a connection with that person. So I was just giving it another try. And if you do not feel like doing therapy, talk therapy, there's other types of therapy as well, such as musical therapy, dance therapy.
Oh yeah, there's all kinds of support groups, group therapy. We have like horticultural therapy with like gardening if you like doing something with your hands. So don't rely only on what you traditionally think of as therapy. There are many different types of therapy. And also it's not what it used to be in terms of I'm going to go sit on someone's couch and talk about whatever is bothering me. I do my therapy via a video call, which is much more convenient for me given my hectic work schedule. So I can do it in the comfort of my own home, which I really enjoy. It's a space that I feel comfortable in. It's a space that I feel most able to open up without being in someone else's space. I didn't realize that that was something that was important to me up until I started. And also what you said earlier about not having a connection with your therapist, that is very true. I've had an initial session with a therapist before that I just didn't feel like we were going to be a right fit. Sometimes it's hard to get that information right off the bat in a first initial session, but if you already know that you are not feeling comfortable, not connecting, for whatever the reason may be, you don't have to provide an explanation, but you should say right off the bat, hey, I appreciate you taking the time to meet with me, but I don't think we're a good fit for each other. Just do the breakup, rip the Band-Aid off, and don't wait too long. I'm sure that they will much rather appreciate you being upfront and honest than carrying on sessions that are not serving you.
Yeah, because you have to do what serves you first. Don't think about this other person. It's not a relationship where it's a breakup in that sense.
Yeah.
You have to remember this is their job, and if you don't feel comfortable with this person, there's no need to carry on with the relationship. And as I mentioned, this is their job. Now, with many insurances, you can get therapy covered through your insurance. And if you cannot, there's still a lot of resources that are available to you through social work and other forms of hotlines and different websites. So look into that. Do not feel as though you have no one and you cannot get help. There are many resources out there for you.
In addition to that, I feel that it's important to take time to reflect on what your values are, what's important to you, and also identify ways that you cope in times of stress and challenges. Just today, I told you something.
Well, first, before you can identify that, you should be able to identify your triggers. And that is anything that is triggering you to make you feel anxious, depressed, attacked.
I don't know that it necessarily always has to be a trigger. I feel sometimes it's more than just one single thing. Sometimes it could be a build-up of things that's been happening throughout the last couple of weeks, whether it be with your family, your in-laws, your neighbors, your boss.
It could be with anyone, but this leads to a snowball effect. that most likely ends in a downward slope. So recognizing these aspects that are contributing and then finding ways to cope with it and relieve stress or anxiety. And today you asked me.
Yeah, so last week, she expressed to me that she was having a little bit of a difficult week. It was challenging for multiple reasons. And I asked her what she needs from me. I think, well, I don't know how you took it, but that's something that I think is important because I don't know if you just need someone to listen, someone to talk to, someone to vent to. You're just not sure what the person needs, so don't assume what they need. Ask them, like, hey, what do you need from me? How can I be there for you? Is there anything I can do for you? And then today, thankfully, she told me she was feeling much better. And I asked her, well, what are the things that you did to make yourself feel better? Because it's incredibly important for you to know the things that you can rely on. And I told her to put it in her feel better toolbox. So when there's an issue, she can go into her toolbox and choose the things that she can do in that moment to help her get to a more balanced place, a better place. And that's different for everyone.
Same as the things that are affecting you. The things that affect you will affect me differently. So it's not a one size fit all. It's definitely different to everyone, same as the tools are different for everyone as well. Some people, and it may change, like sometimes today I may say, I need to talk about this. I need to express my feelings and share it. And tomorrow I might say, I'm not ready to talk about it. So it changes day to day depending on the situation, but you have to know what's right for you and find that balance within yourself.
But also making sure that your coping mechanisms are one, legal, healthy, not harmful to others
or yourself
or animals. We care about the animals too.
Yes.
And the reason I say that is because there are many things that you can do to numb your pain, to distract you from it, not necessarily going to be helpful in the long run. So, in my opinion, and I know this is really difficult, you need to be comfortable in leaning into what doesn't feel good. I think right now we live in a society where things feel good really fast. You get instant gratification and you get instant everything when you think about it. So just taking some time to actually lean into what is unfamiliar, what is uncomfortable, and identifying those things, but also making sure that the things that you're doing to make yourself feel better are things that are actually helpful versus harmful.
And also helpful in the long run. And there's many examples. And part of what we're talking about is substance abuse, alcohol, drugs, but even as simple as, I'm not feeling well, I'm not up to my lively self, I'm going to treat myself to this slice of cake.
And then before you know it, you had the whole cake.
Or you're having a slice of cake every day.
Yeah.
And,
And nothing is wrong with that. If you want to do that because of whatever your sweet tooth, fine. But it shouldn't be something that you use as something to feel better.
Yes, that's what we're trying to say. So you should develop healthy habits to help you feel better, whether it's journaling.
Yeah. I do a lot of journaling.
I do not. We all know I don't like to read and write, so I don't journal.
What I found to be super helpful with journaling is sometimes it can be hard to sit down with a blank sheet of paper and start. That's kind of the hardest part. So what I did was I got a planner, and so that way I just have a couple lines to write. Just 5 lines every day where you would normally be writing the things that you're doing that day. I use that to write a couple sentences, a paragraph. So I don't feel the pressure to fill up an entire page of things. Sometimes you don't have an entire page. Sometimes you have 10 pages. But the important thing is just to start. And it's not something that you feel comfortable with, but there are also prompted journals that ask you things or give you ideas of what to write about. And if you don't own a pen or a pencil, because some people don't these days, the Calm app has a journal where you can identify your feelings. I'm feeling sad, I'm feeling happy, I'm feeling jealous, I'm feeling super tired. And then it asks you.
You can do that in your notes.
You can do that in your notes too, whatever the case is.
Yeah, you don't even need to do this. For example, you don't need to wait until you get home to journal at the end of your day. You can do this on your commute home or in the morning. I know some people like to journal in the morning before they start their day, and then journal at the end of the day to almost do a comparison of like what's transpired throughout the day.
What I thought was interesting is I think I read about someone who was doing a voice journal on their way to the train station. So the same way we're doing audio right now, they were documenting their journaling via audio, which I thought was really interesting. That's a new one.
Yeah.
And I think it's great because you can tell a lot from someone's voice, their tone, there's a lot of emotion that comes out in that may not necessarily come out in writing. So,
well, that's another thing. And we all know that when you're texting someone, you don't know how it's going to come across or how the person is going to receive this message and the tone. So when you speak to someone on the phone, I know, like, for us or with my close friends or family, I can hear it, I can see it in their face when something is wrong. So that also leads us to identifying it for others as well, and being comfortable to ask for help or say, I'm not feeling my best, I'm not in the best of moods today, or whatever you're comfortable sharing, so that people know that this is what you're going through. You don't want them to feel it's something personal against them, and just identify this amongst others as well.
One thing that we use in our family is a safe word or a code word to say that, hey, I'm not having a great day. I'm probably not going to be texting as much as I normally do. I'm probably not going to call today. Everything's okay. Don't worry. I just need some space. I just need some time to kind of reflect and do my own thing. So when I'm having those days, I say today's a quiet day, quiet being the operative word. But sometimes it's nice to have that because you don't need to go into details unless you want to. But our family, we speak every day. And if one of us doesn't hear from the other person, then we're definitely going to be worried that something is going on. So to prevent that and prevent that concern, just saying, hey, I need a quiet day, it helps to settle the concern a little bit. I mean, of course, you're still going to be worried about what's going on with that person, but you know that they're not totally absent. They haven't just gone MIA and disappeared from the conversation, from your day-to-day. So I think that's another helpful thing.
But also, in addition to that, is establishing these boundaries with your friends and family. And sometimes it might be having to tell your mom, I'm not coming over this weekend, or I'm not going to be able to call you at this time today, or whatever is your normal routine. Establishing this boundary and explaining that this is why. It's not that I don't want to see you, it's just that I have so much going on, I need some space, I need to catch up on my own stuff, I need some time alone to reflect, or whatever it may be. Having this conversation and setting the boundaries and setting the expectations as well, that this is what is happening, this is what I'm going through, and this is what I need in return.
I don't know any mother that's going to appreciate hearing that. No one's going to like that. So don't think that your mom is going to have this like aha moment of, hey, go do your thing. Yes. No, that's definitely likely not going to happen. If your mom is anything like our mom, that's only going to make them worry more. But I think being open in the conversation and making sure that they know that it's nothing personal. There is no mother in this world, I think, and I hope, that doesn't want to help their child as they go through struggles and challenges. They want to take away the pain. They want to be there. They want to make it better. They don't want to see you face any sort of hardship at all. We all know that that's impossible. We have to go through our own struggles. That's how we tend to learn. But I mean, we're not parents yet, but I feel that way for my sister, my friends that are super close to me. I definitely want to relieve some of their heartache when they're going through it. But unfortunately, we can't. All we can do is do whatever it is, show up for them in whatever way we can and in the way that they need. Not in the way that you need, but in the way that they need. because their idea of reassurance and comfort may look very different to what you have in mind.
Yeah, that's correct. And as we were saying before, things that can help you in these times where you are stressed or feeling anxious, it may be things that you normally do or just haven't had a chance to do it. And it may be journaling, listening to music, going for
Yoga, being
walks.
physical.
Yes, being physical. That's a big, not trend, but it's a big thing that helps a lot of people, exercising.
That is definitely
being
not a
active.
trend. It is proven that
Yes.
exercising releases endorphins and serotonin, which makes you feel better. So that is not a trend.
No, I said the wrong thing.
She said the wrong thing. She misspoke. Again, we are not giving medical advice, clearly.
Find something that's going to make you happy. Gardening, baking, cooking. Sometimes
Sewing.
Sometimes all you need to do is just binge watch a series.
And that's totally okay. I saw something recently, and this doesn't just apply to people who work in the hospital, but it was geared to that, is when you're in such a stressful environment, as many jobs are, your immune system, not your immune system, sorry, I also misspoke. This is catching on, it's contagious. But basically your autonomic nervous system is always on high, and you're just very stressed. And when you're binge watching that show on your couch all weekend, your system is resetting itself. So don't feel bad for doing that. That's okay, as long as it doesn't become your everyday.
Don't become a couch potato.
Yeah, no one wants a couch potato in their life. But speaking of having people in your life, it's important to know who those people are and identifying who are the people that I can go to and rely on and trust when these moments arise, because it's life. Something will happen one day, and it behooves you to know who you can reach out to. For instance, I always know that I can reach out to my sister, I can reach out to my friend, and I know they're going to be there for me. I know they're going to show up for me. When you're in the moment of crisis, that is not the time to be figuring out who's your friend and who's not your friend. Or that'll be the turning point of when you realize
who is your friend,
and who's not. So knowing your support system, having coping mechanisms in place, and I think also checking in on each other is something that people don't talk about. It's so much easier now than ever before to create community, but more than ever, people are lonely. And when you think about that, right, like you have social media and we can send an email and we can send a text and we can do all these, and we can send a like. You send likes on Instagram, or you just like. You just like on Instagram. You're not sending anything, but you're just liking. You can do all these things, and yet people are so alone. Well, I don't find that very hard to believe because there's no personal touch to it.
And as you say that, I just want to point out that many people that are struggling are great actors and actresses, and they will hide it in their day to day because they know how to hide it. They know what to say, and they know how to act to make it seem like they're perfectly well, everything great, happy, and cheery, but you don't know what they're really going through. So just because you see someone and they seem like they're doing great, that does not necessarily mean that they are. So you should still, they say, so on social media, check on your strong friends because they too are going through something. Everyone is going through something that we don't know. So you should also check on them when you see them, even though they're posting all of these things on social media and you're liking their posts and you're commenting, still check on them because you don't know what they're going through. And that might be a coping mechanism for them, whether it be going on vacation, traveling a lot. It may be that they're trying to run from something that's at home or something else that we don't know about. So checking in on your strong friends as well.
I never thought of that before, to be honest. But I think it's because I don't have social media.
Yeah.
I don't know. Yeah. I don't know who's going on vacation. I don't know who's doing what. I don't know a lot of things. But if I do want to know something, I reach out to the person the old-fashioned way. And I think nothing beats getting a text from your friend saying, hey, I'm just thinking about you. I hope everything's good. And it doesn't have to be a long, drawn out conversation. No one needs that on a daily, regular basis, but just a check in to say, hey, I'm thinking of you. I hope everything is good. Or how are you doing today?
Yeah.
Those are really important. And you should take 5 minutes of your day to reach out to someone, I think. And it can be done at all different times instead of scrolling while you're waiting to pick up your Venti large ice frappuccino at
Venti
Starbucks.
is large.
Okay, the ginormous coffee from Starbucks. Venti is large. Is there something bigger than Venti?
Yeah, it's something with a T.
Oh my god, too many things.
But also, with that being said, when you are reaching out to someone, time and place, obviously, if you know this person is going to have a very long conversation, do that maybe towards the end of your day, not when you're heading into work. Or if you are, just shoot them a quick text. I was thinking about you, but I'm heading into work. I hope you're doing well. Have a good day.
Yeah, done.
Sweet and simple. Something else.
I've never heard sweet and simple. Did you just make that up?
Yeah, I made it up.
It's short and sweet.
Short.
But now we're doing sweet and simple. That could have been the name of this thing.
Sweet and simple.
Well, we might have to switch it up.
Oh, but I was also saying, when you are texting people, you do not have to text all 10 people in one day. You can text one person a day so that you're not overwhelmed with this, and just take it as it comes. You don't have to say, oh, I have to reach out to all these people. Just do it one at a time so it's not overwhelming.
That's a good tip too. Open a window. Get some fresh air.
Be outside.
Get some sunlight.
Sunlight. Let me tell you, everyone in New York has low vitamin D.
Yeah.
Everyone. Be outside. Go for a walk. I say it's a nature walk.
A nature walk.
Yeah. You're in nature and you're walking. It's a nature walk.
She's walking amongst buildings and concrete. I don't know how much nature you're seeing, but if you are, good for you.
In addition to mental health and mental awareness, a few things. Doctors that you should see. You should follow up with your primary care doctor. If you have one, you should get one that is within your insurance. You can do your annual physical with them. Some other appointments you should go to is the dentist.
Lord, yes.
You should go to the dentist because it's easier for maintenance than reconstruction, construction, destruction. I've had it all. I've had it all. The dentist is definitely not one of my favorite people to see. I've learned my lesson. It is far better to just go when you're supposed to go, which is every 6 months. Yes.
Twice a year. Sure. The eye doctor is important. They can diagnose a range of things that have more to do with just your vision. So
if you're at the age, make sure you're doing your mammogram.
Your prostate screenings, which I know men do not like to do.
Still needs to be
done. You still need to do it.
Skin checks.
Skin checks are really important.
Skin checks are very important. I work at a dermatology office, and I would say there are many people that are coming in who have never worn sunblock in their life, and they now have melanomas and other types of skin cancer. When you are checking for skin cancer, make sure that you're looking head to toe. It can be in your scalp, in your hair, and it can be under your feet and between your toes.
Okay, you should definitely look there. But these are things they don't tell you in school, right? No one told us to wear sunblock. We didn't grow up wearing sunblock. So instead of teaching me trigonometry, teach me the importance of skincare and...
Well, I don't think they're going to teach you skincare.
Maybe not skincare, but prevention for skin-related issues.
All organs, and not only the skin. But
the skin is your biggest organ.
Largest organ. Yes.
Largest, yeah, yes. You know what I mean.
But also, they should teach you prevention for heart disease. Eat your Cheerios.
They should also teach you prevention of bankruptcy. They don't teach you anything.
Okay, we're deterring from the topic.
Okay,
here.
yeah, sorry.
That will be another
episode. Sorry, I'm just very annoyed by the school system.
Okay.
Stay away from things that annoy you. That's an important one.
Yes. Going back to mental health.
I'm going back to mental health. I had to switch gears back again. Let me snap my fingers. I'm switching back to mental health. If you're stressed out and you know there are things that annoy you, try to stay away from them.
If you can.
If you
Yes.
can. I try not to get too involved with the news. I'm just going to leave it there. Everyone can take that how they want.
So learning what are and learning how to cope with them is
of the utmost importance.
Yes. And just know that you have many resources available to you. Hopefully you have family and friends that are there.
I also wanted to mention for females and males too, doing your breast cancer self-checks is very important, as well as females going to the GYN to get your pap smear, your whatever testing needs to be done, just go and get it done. I know it's really hard to get a doctor that you connect with, to schedule an appointment, to find yourself in the office and doing it. Make a day out of it.
I would say if you continue to go routinely, which will be for most of these appointments, it's going to be once a year. So you don't have to be best friends with this person because hopefully you only have to see them once a year.
Yeah.
And then you could deal with seeing one person you don't like once a year to make sure you're in good health.
And good shape.
Yes.
What I like to do is I like to do everything in the month of my birthday. Feels like a birthday gift to myself because I am ensuring my health for a hopefully long, healthy life.
And it's a good reminder for you.
Yeah, you remember. So make a day out of it. Meet up with a friend after. Go for a nature walk.
You can go
have the large venti coffee as a treat after.
It's not a large venti coffee.
You know what I mean.
Maybe you can go to the doctor with your friends. You can go to the same doctor.
I never thought of that before.
Yeah.
We don't even go to the same doctor.
No, but it's because of our schedules. But some people in my office, they meet up, they make a day out of it, and then they go for lunch.
It's kind of cute.
Yeah, it's cute. Mostly the older people. But, still
the older
cute.
people know what they're doing,
yeah,
obviously.
They've been doing it for a lot longer than we have.
Hopefully.
Yeah.
Any other health-related things?
Do not believe everything you read on Google.
Oh, on the internet, yes.
Do not believe everything. It's not always true. And if you look it up, you will most likely be diagnosed with cancer because that's what they're going to tell you. That's not always true.
Yeah, the internet did not go to med school. They didn't go to NP school. They didn't go to PA school. So please.
They didn't go to school at all.
Yeah, they're delinquents. Anyway, yes, don't believe everything you read on the internet. Don't believe everything your family tell or friends or neighbor, whatever they tell you. Everybody's different. Everyone's going to have a different experience in their own health care.
And every diagnosis has a different treatment plan depending on what your condition is. Keep that in mind.
Don't take each other's medicine. That's a really important one. Just because you have high blood pressure and someone else has high blood pressure doesn't mean that you should be taking each other's medications.
Just go to the doctor.
Just please go to the doctor. And now more than ever, there's urgent cares everywhere. Yes. So even though you may not be able to establish care with the primary care physician, if something is wrong, please go to an urgent care or an emergency department. Don't go to sleep. You may not wake up. Sorry to end on such a morbid note, but it's true. People have a headache, people have high blood pressure, and then they're like, oh, I'm just gonna sleep it off. Nope, you're gonna be sleeping forever. With that being said, check your blood pressure, check your cholesterol, do some exercise, eat well, drink water, sleep.
Take care of your mental health.
That too. That's probably most important.
Know your resources. Look for them on the internet. You can look for doctors and other forms of tips and advice.
Guidance.
You can speak to your
recommendations.
Friends, colleagues, get recommendations on these things, but do what's right for you. And I think that's the end of this topic for today. Make sure to like, share, and subscribe on YouTube and follow us on TikTok, Instagram, and Spotify.
Bye.
I recently had the chance to meet a group of women who are visiting the United States either on a student visa or a work visa. And the first question that they asked me when I told them I was in healthcare was, how do I find a doctor? Which I found surprising because, this is the system I've grown up with all my life, so I don't know anything different. But many women said that they were unsure of the health insurance that they have and the difference of the different tiers of insurance, they actually said that they wait until they go back home to go to the doctor, which is really, it shouldn't be that way, because I'm sure in America we have great healthcare systems, we have great doctors. So here's a few tips to navigating American healthcare system and insurances, which actually might come in useful for Americans as well who have this system and don't know how to navigate it. So first thing I would suggest is getting to know your health insurance. Get to know what plan you have. With my own health insurance, I have it through my employer, which you're able to pick which tier of insurance you want and customize it a little bit based on your needs. First thing to look out for is a copay. Many times you have a copay, which means you have to pay this for every single visit that you go to. It may be that you only have to pay this for a specialist. If it's a copay, you have to pay it regardless. There are some insurances that have an out-of-pocket and or a deductible. Most of the times, this means that once you have met your out-of-pocket or deductible, that means that everything after you've met it would be considered covered. So personally, for me, I think I have a out-of-pocket of $5,000. So once I spend $5,000, then everything thereafter is covered at 100%. So that's one thing to navigate, and you can help by understanding that. If you have any questions regarding the cost of the appointment, what is covered and what is not covered, always ask the office that you're scheduling an appointment with. And just because you say a doctor is in network, that does not mean that it's covered at 100%. It means that he accepts your insurance, but it may not be at 100%. So you may still have to pay your copay, your out-of-pocket, your deductible, and some other costs. Many times, as I've said before, I work in a dermatology office. Many times we accept the health insurance for the visit, but if we need to do any procedures such as a biopsy, which is pretty much standard in a dermatology office, if you're coming in with a concerning lesion, we will want to do a biopsy. That may not be covered, so we have to check. Even though we accept your health insurance, we have to see if you have an out-of-pocket or a deductible that you have to meet, and then we can give you the cost of these things. So get to know your health insurance, and then get to know your doctor's office and what is covered, what is not covered. Many times you can also have, like for example, for myself, I have one health insurance for medical, separate for dental, separate for vision, and a separate prescription plan, which all can be, I don't want to say customized, but you can choose these plans based on your needs. If you need more prescription coverage because you are on daily managed medication, get something that's higher there. If you know you have great vision, then you probably just need to do your annual eye exam. So getting to know your health insurance is a big part of it. You can always reach out to your health insurance carrier. There should be a website on the back of your insurance card, and you can reach out to the insurance with any questions. They can help you find a doctor as well. Many insurance carriers now have an online portal where you can look up different doctors by their specialty. You can also just use it on the internet. Just Google, I want to go to Dr. John Smith. Let's see what insurances he accepts. But remember, just because he accepts it does not mean it's going to be free. There may be a cost. So just look into that. And if you have any questions, reach out to the insurance. Always ask questions to the doctor's office when you get there. Make sure your procedures are covered. Even as simple down to doing blood work, make sure they're sending it to a lab that is within your insurance network. This has happened to me where they've sent it to another lab that is not within my insurance network, and I was stuck with a bill. In my case, I said, well, I didn't tell you to send it there, so it's really not my fault. And might be able to dispute it, but just getting to know your insurance and getting to know what is covered, what is not covered, and the locations will be a great help for you to navigate these issues so that you can go to the doctor if you need to. Let's hope you don't, but for your annuals and regular checkups, you should be going. And there's no reason you're paying for the insurance and you're not going to the doctor. So let's make use of it and make it beneficial to all of us.